We can use the Faber test to assess for back and hip pain. So you can see Faber right here. My wife's right side's pretty good here. Left side, slightly restricted here. We want this knee to drop below this hip, so you can see it's a little high right here. Faber is a clever acronym that stands for hip flexion, abduction, and external rotation. With this orthopedic exam, along with all the others covered on this page, we are not diagnosing your back pain. That's because this is one isolated test or just one piece of the puzzle. So if you reached out to us because you were struggling with back pain, and if you are, there's a link below to schedule a movement assessment call. If you reached out to us, we would take a detailed history, and then based upon that history, we would do certain tests to rule things in and other tests to rule things out. Kind of like if you go to the airport. You walk through a metal detector. That metal detector is very sensitive to metal. It's not specific to a gun, but sensitive to metal. So then they pull you out of line and they pat you down. That's a specific test for a gun. So what we're doing is sensitive and specific tests, just like that airport scenario, to figure out what your issue actually is here. So by just doing this test and being like, I have hip pain or I have back pain, that doesn't automatically mean it's hip impingement or an SI joint issue, because it's just, once again, one small piece of the puzzle. But the really good thing about these orthopedic exams, they're amazing at measuring, tracking, and monitoring our mobility progress. And what gets measured, we actually make progress on. So what I want to do now is go through how to lengthen and strengthen each component of the Faber test, specifically for improving your mobility. For the lengthening component of hip flexion, we're going to do a kneeling hip capsule stretch. So we're going to be on the floor in this quadruped position. I like to externally rotate this leg to about 45 degrees. Nothing extreme here. Now what I'm going to do in this position, I'm going to anteriorly tilt my pelvis, so arch my lower back. I like to think about shifting my belly button so it's in line with this hip. And now from this position, I think about sending my butt back at a 45-degree angle. So think like 5 o'clock on a clock here. We're not shifting completely out to the side, nor are we sitting all the way back. We're shifting at about this 45-degree angle. So anteriorly tilt the pelvis, shift the belly button in line with the hip. Now drop that hip to a 45-degree angle. You're going to get a deep, dull, achy hip stretch with this. For the strengthening component of the hip flexion, we're going to use a cable hip flexion. You got here, I've got this cuff that I'm going to wrap around my ankle. If you don't have access to this, you can just as easily, well, not as easily, but you can use a band. You can also stick your foot in a kettlebell handle. It's not going to work as well to progressively overload the movement, but it gets the job done here. So what we're going to do with this cable hip flexion, we're going to walk out. And ideally, you want to have some benches for balance, because I don't want this to turn into a balancing exercise. You're going to have some benches. We can use some sticks to support yourself. I don't really like the setup I have, but this is what I'm rocking right now. You'll notice I'm actually starting from a little bit of hip extension here. I also like to have a little bit of forward inclination of my torso. Now from this position, I drive my hip up to 90 degrees, honestly slightly above 90 degrees. I pause for a moment, I come back out of it, going back to that hip extension starting position. Here's what a few reps look like. And this is probably my favorite way to progressively overload the hip flexors here, especially with the cable stack and the cuff here on the ankle. Best setup. As you use a heavier kettlebell, it gets a little sketchy and a little challenging to really overload it. You're not limited by your tibialis anterior on holding a heavy kettlebell, or with the bands, like, are we wrapping it up correctly, or is it going to snap off and like hit us in the face? So definitely the best option, in my opinion, for the hip flexors of improving that aspect of the Faber's test. For the lengthening component of hip abduction, I really like these weighted, elevated frogs. And ideally, you don't even need to use weight at first if your adductors or abductors or just anything on the inner groin are really fucking tight here. But what we're going to do is we're going to set up on something, and the better your hip mobility is, the higher up this is going to be. The weight's going to be on the inside of the bench here, or my knee is going to be on the inside of the bench here. I'm going to wiggle my foot out. And now what I'm going to do is I'm going to rotate away from my leg. And I like to bend my knee and dip my torso down a little. And that's going to traction my hip to get a deep, dull, achy groin stretch right here. It's going to hurt so good. So what a couple reps look like, back to the starting position. Really sink in and let that weight pull me deeper here. Come back up, what one more rep looks like. And with the weighted mobility, just because we're talking about this or I'm utilizing weight here, more weight doesn't necessarily always mean better. There's a certain point with it where we're going to get diminishing returns on our investment. And what I mean by this is if you use too much weight, like if we go to 50 pounds here, because this is 25 pounds, it's just going to be so much weight I'm going to be guarding, and my body's not going to let me sink in or access a deeper range of motion. Just like if I went too light, the weight's not really doing anything. So there's going to be a sweet spot that you're going to have to find specifically for yourself that's just going to come, unfortunately, from a little bit of trial and error. For the strengthening component of hip abduction, we're going to use Copenhagen planks, or if you're really advanced or you need to make it harder, we'll do Copenhagen dips. And what a Copenhagen plank looks like here, we're going to be in the side plank position. The easiest version is going to be resting the inside of the knee here on the bench, hips up ideally parallel to the floor, and we want to make sure we're feeling our groin working here. So either from the upper groin anywhere down to the bottom of the knee. This is where you're going to feel it working. This is the easiest variation. As you want to make it more difficult, we can go out to like mid-shin right here supporting on the bench, or if we need to make it even harder, we go just the ankle supporting on the bench. And now those same progressions of inside of the knee, mid-shin or ankle for the plank, we can do the same thing for Copenhagen dips. So what that would be is from here, dropping the hip towards the floor, coming back up. And I'm really thinking about using my inner thigh and groin to move myself up and down. Because it's really easy to turn this into like an oblique crunch or use my upper body and take the hips along for the ride. But you really need to focus on using these muscles to get the benefit from it. And I want you guys to keep in mind, because I've got this really cool example that I'm excited to show you. With increasing where you're placing your foot on the bench, whether it's the knee, the shin, or the foot, we're increasing the lever length. And it's comparable to doing something like this, because this is what's called mechanical advantage for body weight exercise. Here, this isn't that difficult. You move it out, it's a little harder. You move it out here, it's really freaking hard. And it's the same weight, it's the same lever. I've just manipulated the body position to make it easier or harder. And that's the really cool thing about body weight exercises. For the strengthening component of hip external rotation, we're going to work two different movements. The first one is a wall-supported hip airplane. I don't want it to turn into a balancing exercise. So we can really set ourselves up to focus on strength and eliminate any other things that are going to limit us in making progress here. So wall-supported hip airplane, I'm going to have my shoulder and hip against the wall. This leg's extended out behind me. And now all I'm thinking about doing is rotating. So I'm trying to get this shoulder to touch the wall behind me. And I'm not really, once again, limited by balance because I'm leaning into the wall. And now to make it harder, we can hold a medicine ball, a kettlebell, dumbbell, doesn't really matter. And I'm going to rotate, open up, have that shoulder touch the wall. And I can really feel this hip, the outside of the hip, or the outside of the hip here, working when I do this. You can play with torso angle slightly and find where it really is the most challenging for you based upon your specific areas of tightness, your weaknesses, also just anatomy, limb length, all of that. So this is what a few good reps look like for this wall-supported hip airplane. So another option you guys have here to strengthen the hip external rotation component here is going to be these overcoming hip external rotations. So what we're going to do is we're going to lay on our side. We're going to place a weight under the foot. We're going to try to push up or externally rotate into that weight. So what a complex of this looks like, I'm pushing up into this weight, trying to move it, but I'm not moving. I like to go in 5-second increments where I'm pushing for 5 seconds. I relax. That's one rep. I repeat it for multiple reps. And then after I do a series of multiple reps, trying to push into the weight, I remove it. And we've got a couple options. We can go through reps just like this. Or if you can't lift up, what we can do is you can lift it up yourself, hold for the programmed amount of time, whatever you want to consider a rep. I would say 5 seconds would be one rep. Relax. Hold, 5 seconds, one rep, relax. And probably what would be easier in this situation to have a band or a strap. So you lift it up and then you release the tension. You're holding it. You relax back into the band. repeat for a series of reps. So you can perform isometrics or you can perform concentric reps right here, following the isometric into the weight plate. And then also keep in mind, the higher up we go here, the less leverage we have, so the harder it's going to be. Just like the lower down here, the easier it's going to be to work through that hip external rotation. For the lengthening aspect of hip external rotation, we're going to do a supine hip external rotation stretch. Keep it very simple here. What we're going to do is we're going to lay on the floor, feet against the wall. We're going to take one leg, cross it over the other here. I'm going to take my right hand, I'm going to push my knee towards the wall while simultaneously taking my foot, pulling it towards me. And we want to lift the hips off the floor here. And then once I initiate this push-pull pattern, I'm thinking about sinking or dropping my hips towards the floor to increase the intensity of the stretch right here. And now if you're getting discomfort on the inside or the outside of your knee, so like LCL, MCL, what you can do is you'll see right now the bottom of my ankle is resting on the inside of my knee. You can play with how much or where your shin is sitting on your knee, which can reduce some of that stress. It's going to be based on a few factors like previous injury, limb length, anatomy, all those things, specific areas of tightness. So just play around with what's comfortable for you, because we don't want to have any unnecessary strain on the knee. So once again here, cross the foot over, push, pull, lift the hips up, and then just drop or sink the hip towards the floor to get this deep dole, or if my camera woman's over here, this deep stretch on the outside of the hips here.